Actually, I have two questions. One question is, YB Ismail Sabri stated just now in PC that MKN has already discussed about tightening the SOP in Selangor and KL areas, which are currently in CMCO. And he said MKN will finalize these details before announcement to avoid confusion. So my question is, how would this help Ministry of Health to contain the infection in Selangor and KL? And what are the challenges faced by MOH in containing the cases in Selangor and KL besides high density and mobility of the people, given that the schools are already closed, social sectors already tightening the SOP? And also, second question is regarding to the Ministry of Health suggestion just now that Tan Sri you mentioned, ujian pekala for Parliament. Has it been tabled to MKN already? Thank you.
Thank you very much. So I answer your second question first. Periodic testing every 2 weeks, that's one of our suggestions. So we will table it to the Parliament. I have discussed with the Speaker, and perhaps they will consider the suggestion so that because we are doing it, the testing been done 3 days before Parliament session. So and within 6 weeks period, the members of the Parliament as well as those working in the Parliament are still exposed. So we see institutions, for example, Istana Negara, we see big institutions also they get, the workers get infected as well. So I think this is one of the preemptive and proactive measures that we need to do, and hopefully we can actually continue to do the screening periodic screening every 2 weeks. So that's our suggestion. Second is with regards to in terms of how can we do a preemptive action. If we were to look back, the action taken for Klang Valley implementation of CMCO is actually a proactive, because the cases at that point of time there's only one zone, one Mukim Klang actually is red, but we have taken the measures. That means earlier, and because we have done our risk assessment. And we also know at that point of time the R0 was very high for Klang Valley because of the density as well as the mobility of the population. So we have done that, and nonetheless that we are seeing that perhaps we should be more proactive and to consider before every district becomes a red zone, then only we do or we implement the CMCO. So now we are considering, for example, you look into the graph, look into this chart, basically we are considering an orange zone. Orange zone is case 21 to 40. So now if there's an orange zone, that is an alert, that which means that we may take action in this orange zone, because that is a proactive action. We may continue to tighten the CMCO, meaning we allow the economy sector, but the social sector, the education sector, the sports sectors, we need to enhance our CMCO, and hopefully that we can reduce the mobility of the population then. And we go back to basic. The basic is that in this area, whether it's the yellow, whether it's orange or red, please stay at home, be safe at home. And if you need to go out or to attend to urgent matters, then you have to comply to the SOP.